When we were beginning to adopt Cochlear Remote Care, we did have to work with our cybersecurity team and our IT team to make sure that we were going to be HIPAA compliant and that we maintained security standards for the university and our health system. Luckily, because we were already working with Cochlear using their Cochlear link, which allows them to pull our maps from our programming and put it on patient processors if they're having processor issues, we already had this established relationship that was working and that was secure. So there was no lag time from when we requested to be able to use this and then we were able to implement it in patient care.
When we were getting started with remote care, the Michigan Medicine IT team was helpful in ensuring that the platform was secure, our patients' data was safe, and just making sure that we were able to generally use the technology. One piece that was helpful in streamlining the process was that we had previously been working with some other platforms of Cochlear's, and some of those security permissions were able to transfer over.
The biggest barrier for us for adopting remote care from the start is getting everyone on board and the team buy-in, learning the new technology and making sure you're set up for the technology. So we needed to change some of our IT infrastructure so that we had webcams and microphones, for example, in the clinical rooms to be able to do remote assist seamlessly from face-to-face to remote appointments.
So in terms of looking at the security aspects involved with remote care, there was a lot of work done in the background, not at a clinician level, with Cochlear to make sure that it was going to be safe for us to use with our security systems.
When we were working with our teams to ensure compliance and security with remote care, our IT team worked directly with representatives from Cochlear's IT team, and that was really helpful to address concerns efficiently that were really outside of the scope of our clinical and administrative team.
When we have patients ask us, is this going to be secure? Will my information be compromised? We haven't had any difficulty with that. We feel like it's very secure through the university's end and with Cochlear's team.
When we are talking about remote care with our patients, some do ask about data privacy. One common question is whether they really need to enable data sharing in order to take advantage of remote care. And we really just talk them through what sort of information the platform's accessing and how that benefits them and their ability to connect with us remotely. And we've largely been successful in moving past that concern.
We didn't have any patients that were concerned about it, which was really good. And I think a lot of that is the trust in our program and also the trust in Cochlear.
Cochlear Remote Care is ISO 27001 certified for information security.